Hi everyone. I'd like to welcome you to the last and third in the series of public lectures here at you regarding the best diet. We've previously explored the best diet for the economy and also the best diet for the planet. And this last lecture in the series is the best diet for health. Just to introduce myself, I'm going to chair the session. My name is Dr. Katie Pack. I'm a lecturer in medical education at UEA, at the medical school, and I've got a special interest in lifestyle medicine and plant-based diet. So the structure of the session is going to be a roughly 45-minute talk from our speaker, and then we're going to have some questions. So do feel free to ask some questions at the end, which you can do by using the hands up icon, or if I can't find you and we haven't got another question, you can unmute to ask your question. So just like to go on to introduce our speaker today. It's Professor Shireen Kassam. Shireen is a consultant haematologist at King's College London. She's also the course director of a plant-based nutrition course at Winchester University of Winchester, rather, and that course is accredited by the British Society of Lifestyle Medicine. Correct me if I'm wrong, Shireen, or anything I'm saying. And additionally, Shireen's the founder and director of Plant-Based Health Professionals, which is an organisation seeking to provide education and support with regards to informing us about how the role of plant-based diets for managing and preventing chronic disease. So with no further ado, if we just ask Shireen to share her screen and presentation, and thank you very much for joining us.
Well, thank you very much, Katie, and lovely to have the invitation to talk about my favourite topic. This is the title, What is the Best Diet for Health? And I hope I'll be convincing over the next 45 minutes. Just a little bit more about me, as into how I arrived to be spending my time outside of the NHS talking about diet and health. My conventional background is as a consultant haematologist, mainly as a cancer doctor looking after patients with lymphoma. I did a PhD in cancer pharmacology, looking at the impact of selenium and high doses of selenium in patients with lymphoma. And so sort of that started off my research into nutrition and health. But it was when I became vegan 7 years ago, and I think it's always good to declare one's own diet habit when talking about diet, so that we know up front and centre the speaker biases potentially, but also their backgrounds. I started researching the topic of plant-based diet, and I was stunned to find the wealth of evidence supporting plant-based diets for maintaining optimal health in humans. And I wondered why nobody else was really talking about this within the healthcare system. So I founded an organisation called Plant-Based Health Professionals UK, which does just that. It provides education and advocacy on healthy plant-based diets. And through that work, we've gone on to actually launch a new healthcare service called Plant-Based Health Online just this year with my co-founder, Dr. Laura Freeman, where we use lifestyle medicine and healthy plant-based diets to support people to make these healthy lifestyle choices to prevent and also manage their chronic disease, with the aim of being able to reverse and deprescribe medication. So, and I spend my time at Winchester University delivering an online course on plant-based diets, which I've been doing for the last 2 years. So that's kind of my credentials in the diet space. So what I hope to cover in this talk is an outline of the current state of health in the UK. I'm going to talk about the role of healthy diets for preventing and treating these chronic illnesses, the international consensus, and why a One Health approach is so imperative, and where diet falls into this whole area. So just starting with the current problem, you can see here UK data from the WHO, when 90% of the deaths in the UK are due to non-communicable diseases, and more than half of these, if not 60%, are due to cardiovascular diseases and cancers. Yet we know that 5 main risk factors account for 80% of these chronic illnesses: unhealthy diets, tobacco smoking, alcohol, lack of physical activity, and air pollution. So 4 or 5 of these factors are really related to our behaviour and lifestyle choices. Now, I just want to say up front and centre, I fully appreciate that the socioeconomic determinants of health are extremely powerful and are completely overlapping with what we term as lifestyle behaviours, which may not ultimately be an individual's choice because it's determined by their social and economic status as well, but I'm not going into that area today. And just to note that 11% of deaths in the UK are premature, less than the age of 70, so that's around 60,000 deaths per year. So when we look at the top causes of death and then compare the risk factors, the top 10 risk factors, you can see that the top 10 deaths, as we've said, are cardiovascular disease, predominantly cancers, dementia and respiratory diseases. But when you look at the top 10 risk factors, 5 of these are intimately related to our diet. And, you know, that's fast replacing tobacco as the leading cause of illness and disability. So high fasting glucose, high body mass index, dietary risks in general, high blood pressure, high LDL can all be traced back to our diet and to a lesser extent other lifestyle behaviours. And such that in the UK we're not doing very well. We are chronically unwell. 43% of adults aged 16 or over have at least one long-standing medical condition, and 16% of children have at least one long-standing medical condition. This large data set published by the Global Burden of Disease Study Group just last year, end of last year, showed that globally and including the UK, despite the fact that life expectancy is increasing or has increased to around 82 on average for men and women, our healthy life expectancy is only around 63 years of age. So we spend in the UK, that is 12 years of our life at the end of our life in chronic ill health. And we come back to the reason of why, and this previous large data set, again from the Global Burden of Disease Study Group, and 2019 showed that 1 in 5 causes of death or early death around the UK, around the globe, but also in the UK, was due to an unhealthy diet. And this unhealthy diet was leading to 11 million deaths per year. That's globally, 1 in 5 deaths. And if you break it down into what are the components of an unhealthy diet, you can see the top 5 here. The diet's high in sodium, and that's clearly a reflection of our consumption of pre-prepared, processed packaged foods. And then the next 4 are because we're not eating enough whole plant foods. We're not eating enough whole grains, fruits, vegetables, nuts and seeds. And these dietary risk factors are leading predominantly to 3 illnesses: cardiovascular disease, cancer and type 2 diabetes. We've got a unique problem in the UK compared to the rest of Europe. We are consuming more than 50% of food as ultra processed. So 50% of food that goes into our shopping baskets would be classified as ultra processed. And the level of chronic disease and the diet and lifestyle factors contributing to this chronic disease has really come to the forefront during the COVID-19 pandemic, because we know that those people who are faring the worst, getting admitted to hospital, ITU, and ultimately dying, have underlying chronic health conditions. In the UK, 90% of people admitted to hospital have an underlying chronic health condition, and this includes overweight and obesity. Big data set from nearly 1 million admissions in the US just published showed that 60% of hospital admissions in the UK were due to hypertension, heart failure, obesity, type 2 diabetes, and that's in relation to having COVID-19. So these are the reasons they were admitted alongside the COVID-19. So what is the real solution to this huge burden of chronic illness? Well, the medical community, as Katie was saying, have soon realised, possibly belatedly, that a lifestyle medicine approach could remove or reverse or eliminate 80% of chronic illness. And the 6 pillars of lifestyle medicine are shown here. So healthy diet, regular physical activity, avoidance of toxin, maintaining healthy relationships, restorative sleep, and adequate stress management. And clearly, I would say that nutrition is the most important pillar, and I'll dedicate the rest of the talk to this. So when it comes to a healthy diet, the American College of Lifestyle Medicine, founded in 2004 and launching this global movement that's reached the UK in the form of the British Society of Lifestyle Medicine, states that the eating plan that they recommend is one that's predominantly based on a variety of minimally processed vegetables, fruits, whole grains, legumes, nuts, and seeds, and hence coming back to my interest in a plant-based diet. So I think before we move any further into what we consider the best diet, I think we need to understand what factors determine the best diet. And these are my thoughts on the topic. So of course, the best diet needs to be nutritious and healthy. It needs to be sustainable for the producer, society, and the planet. And we're not achieving that. Just as an example, we know that the corporate food system and the capitalist sort of profit-driven system is really crowding out small farmers, such that, for example, in India, 300,000 farmers have committed suicide since 1995. We're not being sustainable to the producer. It needs to be affordable and accessible, and this comes back to linking a higher chance of having an unhealthy diet for those who are of lower socioeconomic means. It needs to be culturally adaptable. It's no use telling me as someone with a background of Indian cuisine what a healthy diet is in terms of European cuisine. It's just not going to be culturally acceptable for me. And I think we need to assess that a healthy diet, or the best diet, needs to be kind and compassionate to the earth, to humans and non-human animals, and our food system is interlinked in that way. But maybe my work is done. Every year in the UK, for at least the last decade, the US News and World Report ranks the healthiest diets, and it brings together 35 experts to do this. And in fact, this year you can see they ranked 39 diets, and they base it on, the acceptability, whether it prevents chronic illness, whether it's sustainable, all these different factors. And for 4 years in a row, it's declared that the Mediterranean diet pattern, whatever that means, is the healthiest diet. So if we consider what the traditional Mediterranean diet is, here is the sort of conventional pyramid. So you can see, it's interesting, isn't it, that physical activity forms the base of this pyramid, and also enjoying meals with others. But the bulk of this pyramid is fruits, vegetables, whole grains, olive oil, so a healthy plant-based oil, beans, nuts, legumes, herbs and spices, every meal. And then a couple of times a week there's fish. Maybe weekly there's things like poultry, eggs, cheese and yogurt, and much less often meats and sweets, and not all parts of the Mediterranean drink wine, and there's predominantly water for thirst. But when you actually look at studies that have examined which foods in particular are associated with the better health outcomes, it's really the plant-based foods in this diet. It's not the animal-based foods at all, nor the alcohol for that matter. So when you look at data from the Greek EPIC cohort, more than 20,000 participants on a Mediterranean diet followed for 8.5 years, the bars to the left of the line show reduced risk of mortality, and to the right of the line, these bars show increased risk of mortality. And you can see that the only ones associated with better health are vegetables, legumes, so beans, pulses, chickpeas, etc., fruits and nuts, cereals, and mono and polyunsaturated fats coming from plant-based sources. And then when you look at fish, dairy, meat and alcohol, they're all to the right of the bar, showing increased risk of mortality. So we come back to the seminal study that people quote to suggest that the Mediterranean diet is the optimal diet. And this was a primary prevention study conducted in a number of countries, included almost 8,000 people, followed for around 4.8 years when this study was reported, and it was looking at people at high risk of cardiovascular disease, and it randomized people to a supposedly low-fat control diet, although it never achieved a low-fat diet, and then 2 Mediterranean groups, one with extra virgin olive oil and one with a portion of nuts every day. That was 30 grams of nuts, and the extra virgin olive oil was around 50 mils, so 4 tablespoons. And after the long follow-up, they showed that, yeah, there was some reduced cardiovascular disease events, mainly due to a 40% reduction in stroke, actually, rather than heart disease from the nut-consuming group. But there was absolutely no improvement in mortality, and clearly that's the holy grail. We want to stop people dying early. Now, we just need to take a step back so I can explain this plant-based diet index. So researchers look at food frequency data or data collected in diet diaries by looking at scoring systems that score foods as healthy or unhealthy. And there's a newly developed score. Well, it's not that new. It was back in the late 90s, actually. The Plant-Based Diet Index scores your diet based on whether you're eating healthy plant foods, unhealthy plant foods, or animal foods. And all the healthy plant foods here are given positive marks. And then unhealthy plant foods are given negative marks, and animal foods, all of the animal foods, including fish, are given negative marks. So when the PREDIMED investigators here back in 2014 went back and examined all that PREDIMED data again, but scoring it with this plant-based dietary index or pro-vegetarian index, you can see that the more plant-based foods included in the diet, you actually have an impact on mortality. Those eating the most plant-based foods in the highest 2 quintiles had the lowest chance of dying. So they summarize, we provide evidence to support that the simple advice to increase the consumption of plant-derived foods with compensatory reductions in consumption of foods from animal sources confers a survival advantage to older subjects at high cardiovascular risk. So since then, people have gone on to try and improve the Mediterranean diet. So we've come to hear about papers on the green Mediterranean diet. And this diet is one that includes more plant-based foods than the traditional Mediterranean diet, less red meat and poultry, and also added in components including green tea, mankai, which I'll come back to, and walnuts. Now, mankai is a duckweed, and this is where we come back to things talking about, is this accessible? Is it culturally appropriate? I suspect we're not all going to go out and eat or find mankai in our supermarket shelves. So nonetheless, when they make the Mediterranean diet more green, in inverted commas, they have reported 2 papers so far that I've seen in randomized control studies to show that the green Mediterranean diet outperforms the traditional Mediterranean diet by reducing cardiometabolic risk factors and also being a very effective treatment for fatty liver disease, something that in Western societies is a growing problem. So then I guess the question arises, well, what about comparing a Mediterranean diet with an absolutely 100% plant-based diet? And finally, just a few weeks ago, this randomized study was published by people I highly respect at the Physicians Committee for Responsible Medicine, Neil Barnard. He's done the nutrition world a huge service. So we've had a head-to-head 12-week crossover trial where overweight people were put in either the PREDIMED version of the Mediterranean diet or a low-fat vegan diet. And we'll come back to what that definition is in a minute. And basically, my interpretation is that the vegan diet outperformed the Mediterranean diet. The vegan diet had significantly better weight loss, lowering of cholesterol, improved insulin sensitivity, whereas the Mediterranean diet, nobody lost any weight, and probably because they were consuming 50 mils of olive oil every day. Having said that, it wasn't just all green light to the vegan diet. The Mediterranean diet had a better impact on blood pressure, and we can perhaps come back in the discussion to talk about that if it's of interest to anyone. So just going back to that healthy plant-based diet index I was talking about, there have been a number of studies, all quoted here, that have looked at the impact of this healthy plant-based diet score on disease outcomes in observational studies. And basically in all the commonest diseases, you can see that a plant-based diet reduces the risk of this chronic illness and the risk of death. Now, there's a caveat here. If you score highly on the healthy plant-based diet, you have significant reductions in coronary heart disease at 25%, that's huge, diabetes 34%, stroke 10%, renal failure, and you reduce your risk of dying by 10%. Yet, if you're swapping to an unhealthy plant-based diet, which is full of processed foods, refined sugar, refined grains, then you will actually do yourself a disservice. So there's a warning there in that it's not enough to say, I'm eating a vegan diet, because that doesn't tell you what a person is eating. We want people to be eating a healthy, whole food, plant-based diet. Now, in the literature, you'll find many therapeutic diet patterns, and they're all based around healthy plant-based diet. So you've got the DASH diet, which the researchers tell us was based on the vegetarian diet, but they included small amounts of low-fat dairy and poultry because they thought it wouldn't be acceptable to people to tell them that it's actually a vegetarian diet that's associated with the better health outcomes. So the DASH diet was developed as dietary approaches for stopping hypertension, so it's specifically for high blood pressure, and it is as effective as medication on lowering blood pressure as is a vegetarian diet. Researchers have gone on to show that this DASH diet pattern is good for all sorts of chronic illnesses. You'll have heard of the portfolio diets from Dr. David Jenkins at the University of Toronto. It's a 100% plant-based diet emphasizing soya, plant sterols, viscous fiber, and nuts. And in randomized studies, it shows that it can lower your cholesterol to the same extent as first generation cholesterol medication. And of course, we've all heard of the Japanese diet, the Okinawan diet. 70% of their calories come from the purple sweet potato. So just to emphasize, there's not necessarily one way of doing a plant-based diet, but the healthy components of any therapeutic diet pattern are the whole plant foods. And as I say, we need to be mindful of the fact that we recommend culturally adaptable diet patterns. So, just to give you an example, Indigenous diets in the South American region of Tasmania, I hope I pronounced that correctly, shows that these individuals who are really foragers and do a little bit of hunting have 70% of their calories from carbohydrates, meaning whole plant foods, have some of the lowest rates of coronary heart disease when they have been observed in cross-sectional studies. And when you sort of give an Indian flavor to the Mediterranean diet, emphasizing, beans and chickpeas and whole grains and things that Indian diets are high in, you can also show that this will have a beneficial effect on the progression of coronary heart disease. And really, the common themes of these healthy diet patterns are that they're high in whole plant foods, low in saturated fats. They don't include they are minimally processed, and they're free of processed foods, so free of trans fats and refined carbohydrates, and of course, high in fiber, a nutrient that the UK population is highly deficient in. We have overwhelming evidence to support. For example, when you're looking at observations of people and communities that live the longest, healthiest lives, and it's a term coined for regions of the world listed here where people are more likely to reach 100 than anywhere else in the world, and this is a centenarian from Okinawa. This is lifted from the Blue Zone's website. When you look at their diet pattern, it's 95 to 100% plant-based. So for example, in Loma Linda, many people follow a vegan diet. I've already said in Okinawa, 70% of the diet is purely from the purple sweet potato. They go for the whole diet. Yes, they can eat raw and cooked and fermented, but it's not processed. Beans are an essential part of the diet. Water for thirst, daily snacks on nuts. And then it's minimizing fish, eggs, sugar, dairy, and retreat from meat. There is no need for meat in the diet. When you look at large, robust, prospectively conducted observational studies in men and women, and this is from the Nurses Health Study and then Health Professionals Follow-Up Study in the US, more than 170,000 men and women followed for more than 30 years, and you look at 5 healthy lifestyle factors. Have they ever smoked? Healthy diet, regular physical activity, and moderate rather than excessive alcohol. And just to delve in a bit deeply, they use this scoring system for the diet. So positive marks for fruits, vegetable, whole grains, unsaturated fats, and omega-3 fats that can obviously come from fish or plant sources, and low intakes of meat, processed foods, and salt. What they found was after 30 years of follow-up, the best quality diet, you could reduce your chances of dying from cancer by 30%. The best quality diet, you could reduce your risk of cardiovascular death by 33%. If you had all 5 healthy lifestyle factors, you reduced the risk of dying from cancer by 65% and cardiovascular death by 82%. There's nothing I can prescribe or any procedure I can do that will have these immensely positive outcomes on your health. And people lived longer. At 50 years of age, if you had all 5 healthy lifestyle factors, you'd been following all that healthy lifestyle advice, men lived 12 years longer and women 14 years longer. And their healthy years, they looked at whether people were in good health, and they were. So what about studies on vegan health? The most robust data on vegan health, as in people who follow a 100% plant-based diet, comes from the Adventist Health Study run out of North American, which has followed 96,000 Seventh-day Adventists from 2002. And here in the UK, we have the EPIC Oxford cohort, more than 65,000 participants followed since the early 90s. And they're not all vegan, but a third of the participants are lacto-vegetarian or vegan. And so it's given a platform for comparing the health outcomes for vegans and vegetarians compared to pescatarians and omnivores. And these are some of the headline findings. If you're vegan, you're the only diet pattern group that is going to be in the normal body mass index, less than 25. If you're vegan or vegetarian, actually, you have an almost 50% reduced risk of developing type 2 diabetes. If you're vegan, you slash your risk of hypertension by 63%. If you're vegan, you have the lowest blood cholesterol level. When you look at all the data together in a meta-analysis of vegetarian and vegan health, you can see that the rates of ischemic heart disease in vegetarians is reduced by 25%, and vegans have a 15% reduced risk of developing any cancer. So that's to cover some of the health outcomes that can be expected. And, you know, the question of nutritionally adequate, well, yes, all the major dietetic associations around the world, including the BDA, have confirmed that well-planned vegan diets can support healthy living in people of all ages. And the term well-planned should be used for every diet pattern. You know, the current omnivorous Western diet pattern in the UK is not well-planned. On average, adults eat, only 28% of adults consume 5 portions of vegetables and fruits a day, and only 18% of children. The average intake of fiber a day in adults is 18 grams, whereas we should be aiming for 30 grams or above. Now, there's always media hype, and I'm sure some of you will have questions about some of the recent stories on vegan diets. And the papers love a negative story on vegan diets, and some of the data out of the EPIC Oxford about strokes and bone health can be reasoned in more than one way, and we can come back to that. But the key point about plant-based diets, whether they're 100% plant-based or predominantly plant-based, is that they truly address the root cause of chronic illness, which comes down to inflammation, this chronic inflammation that's associated with every single disease, including cardiovascular disease and cancer. And unfortunately, overweight and obesity is a chronic inflammatory condition, which then predisposes people to the other associated diseases. But the other aspects of disease pathogenesis that's addressed by plant-based diets are these listed here. So we know the importance of a healthy gut microbiome. Well, you need fiber from whole plant foods. You're not going to get that from any other source. So the more plant-based foods that you eat, the healthier your gut microbiome. The American Gut Project showed that the healthiest, most diverse gut microbiomes were in those that were consuming 30 different plant foods a day. Sorry, a week. A day would be challenging. I would actually ask you to think whether you consume that many plant foods in a week. Even I find it challenging with being on a 100% plant-based diet. A plant-based diet reduces hormone levels like estrogen and insulin-like growth factor. That's some of the reasons why cancer risk is lower. Your diet, whether it's unhealthy or healthy, will alter gene expression, and plant-based diets do that in a favorable way. Unhealthy diets will shorten your telomeres. Plant-based diets have been shown to extend the length of telomeres. Plant-based diets reduce your risk of insulin resistance and oxidative stress. Plant-based diets address all of these underlying mechanisms. And the particular foods we have known for decades that contribute to inflammation and chronic disease are refined carbohydrates, so sugar, white flour, white rice. Fried foods, clearly any fried foods, even if they're plant-based foods, are going to be in the unhealthy inflammatory category. Sugar-sweetened beverages that we all know about. Red and processed meats, we need better messaging on that. Processed meat was classified as a Group 1 carcinogen in 2015. It contributes to over 5,500 of cases of colorectal cancer in the UK a year. Just one portion a day will increase your risk of colorectal cancer by around 18%. And red meat is a probable carcinogen. There is no place for these foods in the diet. Saturated fat is inflammatory. It contributes to elevated cholesterol, atherosclerosis, abnormal gut microbiome, and is predominantly found in animal foods. Bar a few plant-based foods, saturated fat in our diet is coming from animal foods. And obviously alcohol is a toxin. It's clearly a Group 1 carcinogen also. It contributes to around 1 in 20 cancers globally and in the UK. So the foods we should be concentrating are on eating the rainbow. Nobody will disagree with me that fruits and vegetables full of antioxidants, anti-inflammatory compounds are the basis of any diet. Beans are essential as your source of plant-based protein and outperforms any other animal-based source of protein. So if you compare fish, eggs, dairy, meat with beans, beans will give you better health outcomes. We need a diet full of micronutrients, vitamins and minerals, and these are only coming from plant-based foods. We need to increase our fiber, and this is only coming from plant-based foods. Herbs and spices full of antioxidants, water for thirst, tea and coffee if you enjoy it, it's perfectly healthy. And in this last year of the pandemic, the role of vitamin D in the immune system, but also in preventing chronic disease, has really come to a fore, and it's an issue for any diet pattern, especially when sunlight is limited or exposure of the skin to sunlight is limited. So we come back to reminding ourselves about what I am trying to convey is the best diet for health. It's a healthy plant-based diet. In the profession, we refer to it as a whole food plant-based diet because these are the only foods that have been associated with good health outcomes and in keeping people in long and optimal health. Fruits, vegetables, whole grains, legumes, meaning beans, chickpeas, peas, peanuts, etc. Portion of nuts and seeds every day, assuming you're not allergic and can tolerate it, is awfully useful, and water for thirst. And the good news is it's never too late. This man, I'm embarrassed to say it was back in 1990, reported a randomized study in patients showing that with a healthy plant-based diet and other lifestyle interventions, you could arrest the progression of coronary heart disease in people with really severe heart disease. At the same time, Caldwell Esselstyn at the Cleveland Clinic was putting these end-stage patients on a plant-based diet. He didn't ask them to do anything else. He didn't ask them to exercise or manage their stress. He just put them on a plant-based diet. And he was able to show within weeks and months that you could open up blocked arteries and blood flow to the heart. Tortuous arteries opened up again on a plant-based diet. And, one of the core mechanisms that I'm talking about with chronic disease is inflammation. And we realize that even heart disease is not just a disease of coronary artery plaques I mean, yes, there's plaque buildup because of the cholesterol and saturated fat, but it's really the inflammation created in those plaques that then ultimately lead to coronary heart disease. So people are using monoclonal antibodies to dampen down inflammation. These are a new brand of drugs for atherosclerotic disease. Yet, when you compare the vegan diet compared to the diet that recommended by the American Heart Association, which is essentially a Mediterranean-style diet, low on red meat, emphasizing fish and dairy and plant-based foods, what you find is that a vegan diet is actually able to reduce inflammation to a similar level to that reported with the monoclonal antibody, a 30% reduction in inflammation. The AHA diet group didn't fare so well, such that the clinical implications of this peer-reviewed paper showed a vegan diet may be used to lower inflammation as measured by high sensitivity CRP, a key player in the development of major cardiovascular events. So that brings me back to why a plant-based diet is so heart healthy. And in the same diet ranking that's performed for every year in the US, for the last 10 years, the Ornish Diet, and this, by the way, is the diet that Bill Clinton adopted after his quadruple bypass. He went to see Dr. Dean Ornish, went on a plant-based diet, and you've all seen those before and after pictures of him having lost loads of weight and feeling a lot better. He went on the Ornish Diet because it's safe and it's heart healthy. So this analysis shows that it's difficult to adhere to, but this is the diet pattern I adhere to, and really, with a small amount of skills and knowledge, it's perfectly adaptable to all diet patterns. Weight loss, again, we've seen a whole food plant-based diet intervention in the community in New Zealand conducted by GPs, and the conclusion back in 2017, to the best of our knowledge, this research has achieved greater weight loss than any other trial that does not limit energy and mandate exercise. So people can eat as much as they want and they still lost weight on a whole food plant-based diet compared to the conventional diet that's recommended for diabetes in New Zealand. Same for early stages of prostate cancer. Now, I'm not talking about replacing allopathic medicine. I'm talking about people here who would be on a watch and wait approach for prostate cancer. Early stages don't need to be treated. People are told to go away, come back in a year, but you can take some active measures to reduce the progression of the disease. Dean Ornish looked at this in a randomized fashion with patients with early stages of prostate cancer. And after a year and 2 years, he was able to show a reduction in the PSA level in the lifestyle group compared to an elevation in people who didn't change their lifestyle, such that 2 years follow-up, over a quarter of the control group had to go on to have surgery and radiotherapy, whereas only 5% in the lifestyle group. And he was also able to show the mechanism. We come back to knowing and understanding why plant-based diets are so important. He was able to show lengthening of the caps of the chromosomes, the telomeres, after 3 months in peripheral blood mononuclear cells. And he was able to show in prostate cancer biopsies before and after that you changed gene expression favorably. So the genes are not your destiny. You know, we all say genes load the gun, but your lifestyle pulls the trigger. I just wanted to break up this heavy science-based talk with some success from my husband during lockdown. He's a doctor. It took coronavirus to really get him into action. Because the fact that you are so much, you've increased your risk so much of an adverse outcome from COVID-19 with chronic health conditions. He was obese. He had an unhealthy waist circumference. He was hypertensive. In his omnivore days, his cholesterol was 6.5. We've done a year of whole food plant-based diet. He eats what I eat now. He's lost over 2 stone. His BMI has finally reached the healthy range. He is no longer hypertensive. His waist circumference is healthy, as is cholesterol. If he'd been to the doctor as a 45-year-old male with these stats, I think you can guess what the recommendations might have been. So is everything that I'm saying endorsed by international recommendations? Well, yes, it is. 2019, American College of Cardiology, which is a chapter of the British Cardiology Society as well, they recommend a plant-based or Mediterranean diet, and they specifically mention the benefits of a vegan and vegetarian diet in the article. Diabetes recommendations. People with type 2 diabetes, all patients should strive to attain and maintain an optimal weight through a primarily plant-based meal plan. Cancer recommendations. Eat a diet rich in whole grains, fruits, beans, vegetables. This is my description of a whole food plant-based diet. We need to start thinking of a One Health approach. It's not good enough to think about just our individual health here in the UK. We have to think of the bigger picture, and our house is on fire. We are in a climate crisis, and such that the impact of climate change is now affecting the health of individuals and communities, and causing people to migrate from their homes. We are also in an ecological crisis. We have entered the 6th mass extinction event, and this study, published 5 years after these scientists warned us that we'd entered the 6th mass extinction, states that we are accelerating and we have made no progress at all, and species extinction is going to accelerate by the end of this century. They have a rather stark warning in this paper that I quote: "There is time, but the window of opportunity is almost closed. We must save what we can or lose the opportunity to do so forever. There is no doubt, for example, that there will be more pandemics if we continue destroying habitats and trading wildlife for human consumption as food and traditional medicines. It is something that humanity cannot permit, as it may be a tipping point for the collapse of civilization. What is at stake is the fate of humanity and most living species. Future generations deserve better from us." And as health professionals, we've been told we are key players in the climate crisis and the ecological crisis. Without decisive and urgent action, the climate crisis will increasingly undermine human health and disrupt healthcare delivery. There are both moral and practical reasons for health professionals to be at the forefront of climate action. So why am I telling you about climate and ecological crisis in a health talk? Well, clearly animal agriculture, and you know this from your previous talk, is the leading cause of climate crisis and the ecological crisis. You can have these slides and see the facts here, but we all know about the contribution of animal agriculture to greenhouse gas emission, species extinction, habitat loss, water and land pollution, and the creation of ocean dead zones. I'm sure you'll also have heard about the EatLancet Commission, which brought together 36 scientists from 20 different countries, and they came up with the diet that would not only sustain our human health, but the health of the planet and keep us within planetary boundaries. And here it is on a plate. This is a predominantly plant-based diet. The only exceptions made are dairy foods and animal source protein. If you choose to have it, it makes it clear that these are a choice and they shouldn't be more than 15% in the diet. In fact, they add up to 13.5% of your calories, but they are not essential, and plant-based sources of protein should be your primary source. And with this, we come back to the fact that they estimate in this report that 11 million deaths could be prevented each year globally. This is the same 11 million that I showed you up front that were due to an unhealthy diet. And again, health professional organizations here, the one that represents family physicians around the world, they're called WONCA, advise patients to transition to a more sustainable plant-based diet in line with the EatLancet Commission. And my group have been trying to highlight this issue during the pandemic, because the next pandemic is just around the corner. COVID-19, we all feel, is a warning. We know that animal farming, particularly intensive animal farming, which is the predominant form of farming chickens and pigs, for example, in the UK, is going to be the cause of the next pandemic. We've also already had bird flu outbreaks, and many bird flu, when transmitted to humans, have a mortality rate of 30 to 50%. I mean, that is hideous. We need to stop this because it's unnecessary. We need a food system that meets the requirements of society. Those requirements I listed up front, and they do not provide us with nutritious, healthy food that's sustainable for humans, non-human animals, and the planet. Luckily, some country-based guidelines are being true to the science and true to our climate and planetary needs. Here, Health Canada's latest guidelines, you can see it's a predominantly plant-based plate, fruits and vegetables, 1/2 whole grains, and then protein. It's got a bit of pictures of animal protein, but it clearly says in the text, choose plant protein over animal protein. There's no distinction for dairy here. They recognise that dairy is unnecessary in the diet. It's not inclusive of cultures and minority groups that have lactose intolerant, and it is calamitous for the environment. And I don't think we can leave a talk like this without mentioning the interconnection between animal and human justice. We expect our fellow humans to work and slaughter animals, and we treat our animals so badly, when actually there's no difference between a farmed animal and our companion animals we keep at home. So I hope I've convinced you that there's a large body of evidence to support plant-based diets for prevention and treatment of chronic disease, that international and national guidelines are catching up with the evidence, and that human diet and health have to be considered in the context of global planetary health. So if any of you are convinced and want to extend your education, this is my course, and I'm sure Sylvia can send out the details if you'd like them. And I really hope that we are finally, a century later, going to start practicing medicine in the way that we should have been all along. Doctors of the future will give no medicine, but will instruct his patient in the care of human frame, in diet, and in the cause and prevention of disease. On a broader topic of the food system, its problems and how we resolve them, I highly recommend With a Large Dose of Bias. My father and sister have co-edited this book that came out earlier in the year. I would request your university order it, because it covers every single aspect of what I've covered in the context of the global food system, and readily available sources of Netflix movies like Forks Over Knives and The Game Changers, and books such as Vegan Savvy and How Not to Die are readily available and highly recommended.
Thank you very much, Shireen. That was an absolutely brilliant lecture. It's incredibly comprehensive and convincing. And I can't say personally I'm surprised, because Shireen collates the research relating to this topic on a weekly basis. Is that right, Shireen?
I do. I've started doing that. I really feel like I wish I hadn't called my blog a weekly update, because now it's like weekly.
Yeah, it's a lot of work. And I usually access that via your Plant-Based Health Professionals Instagram account. Is that the best place for people to?
Anyway, I post it on a Sunday on all my social media channels. So Plant-Based Health Professionals on Instagram or on Facebook or on Twitter. But if you just want to go to the website, it's under our health zone under a weekly news update.